Last week, a medical team from Northern Ireland visited Lebanon to provide free, high-quality consultations and medical care for people living in rural areas. Over the course of a week, the team treated hundreds of patients at Thimar partnered churches in Lebanon's northern Akkar and Chouf regions. As part of our church discipleship efforts, Thimar Salt and Light Ministry helped organize the trip. With backgrounds in dermatology, pediatrics, dentistry, and more, these volunteers saw both residents and refugees, providing high-quality treatment that people might otherwise not be able to afford. Just beyond the reception desk at the center, nurses check patients arriving for their consultations with the team's doctors.
Hi, my name is Cheryl. I am a nurse from Northern Ireland, from a little town called Newtownards, which is not too far outside our capital of Belfast. I've been a nurse now for 24 years and I work in trauma orthopedics. Here we're a team of 12 and here providing medical, dental and nursing work. And our role is to offer that practical help and that practical treatment to the local people here so that that can help support the church to show the love of Jesus, to show God to this local community.
After being checked by the nurses, patients then visit one of the doctors for a one-on-one consultation. Craig is one of the doctors seeing adult patients.
This is my second trip out to Lebanon. I work as a general practitioner, family doctor, and I also work as a dermatologist back home in Belfast. We see people with lots of different problems. We see people with long-term health problems, with diabetes or high blood pressure. We also see people with skin problems. Previously I saw a guy with a skin cancer that I was able to remove for him. I think it's a real privilege to come out and work in Lebanon. Last trip that I was out in, of a group of 10 people, I was 56 years old and I was the youngest person on that trip. So it's a real challenge to us in Belfast and in the West in general, that just because you're a bit older doesn't mean that these opportunities aren't open to you.
Children also come to receive care. With Lebanon's Independence Day just a few days away, several children visit the clinic dressed in their country's military uniform. Colin, a recently retired pediatrician, welcomes the kids.
I am a Christian grandfather. I've been a Christian since I was 7, and the Lord Jesus is more precious to me now than ever before. And so the idea that I would spend my retirement pottering around doing a little bit of nothing is just not something I can really think of. I've been 3 times to Lebanon, and I have always been struck by how remarkably happy the kids are. They often don't have a great deal of resources, and I am just amazed that they're not crying or miserable or fearful. Their parents are lovely.
In a separate room, other patients receive dental care.
We're doing a lot of extractions, fillings, and just to see how we can help this community, to encourage them and support them in the work that they're doing in the church here. On Wednesday night we set up the clinic here in the church, and we're spending the next 2 days treating as many patients as we can. We ask them would they like us to pray with them and for them, and we share a bit, and we try to get alongside also the church members here as well and find out what's going on with their lives, ask them if we can support them, how we can pray for them. We get prayer requests, and just spend time with the people in the community here alongside the medical and dental treatments we're providing.
The team as a whole is providing both medical and dental care. Both of us will extract teeth, Rachel and I. Rachel will then also do fillings and other treatments to get people out of pain.
Probably about 10 years ago, I had a real heart for refugees and people in need, and I came to Lebanon in 2022 and just loved the whole experience. It has just been able to serve and to meet a really growing need, both within refugees but also within with the Lebanese people as well. And even that, if that's to help them with dental care, which we know is very expensive here, and we know medicines are expensive, so being able to support them in that way that might ease their economic troubles but also their worries at kind of when they're coming around this time.
Medical trips like this reflect our mission at Thimar to support communities in the Arab world. By working alongside our church partners, this medical team is able to provide much-needed care to communities afflicted by domestic turmoil and regional crises. Though many challenges remain in our country, initiatives like this gradually make a collective difference.
Bye-bye. 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 Bye-bye, Ryan.